This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan. Hey beautiful soul, it's Jacqueline here from the Labia Chronicles, where I discuss all things lichen sclerosus. So if you have lichen sclerosus and are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to this channel and keep on watching. And if you have a friend or a loved one with lichen sclerosus and you want to learn more about the physical and mental struggles of living with lichen sclerosus so that you can better support them in their lichen sclerosus journey, then please subscribe to this channel and share it with them. Okay, so in today's video, I'm going to be talking about the difference between signs and symptoms of lichen sclerosus and why that distinction matters. So I'm doing a bit of an experiment here. I'm going to kind of play with doing some shorter, more informational videos. If you enjoy that, please leave me a thumbs up so I know, and then I will try to incorporate and throw in some shorter informational videos into the mix. As always, if you find the information in this video helpful, please give me a like, leave a comment, let me know if you learned something new, let me know if you have topic requests, anything, you want to share your story. I love chatting with you, so please leave a comment down below. Of course, if you have not got my free ebook on lichen sclerosus, I highly recommend that you check that out. I overview diagnosis, treatments, complementary treatments, how to pick a treatment plan that is right for you, and how to build a proper support network, and so much more that is free. You can get it at www.loslabia.com/ebook. You can always go to the description box. I will leave that link there. And also do check out my shop that I just recently launched. You can check that out at www.loslabia.com/shop. There are going to be some ebooks and workshops that I'm going to be hosting this year in 2022. So definitely subscribe and make sure that you are up to date on when those workshops will launch. All right, let's jump into signs and symptoms of lichen sclerosus. All right, let's start with signs. When we talk about vulvar lichen sclerosus, a sign is something that someone can physically see on the vulvar skin. That someone could be either the patient or the doctor, but in either case, if they are looking at the vulvar tissue, they are able to see it. Some examples of signs of lichen sclerosus include discoloration. Now, when we talk about discoloration, we're mostly talking about whiteness. So I have this little vulva puppet from the Body Agency. So when we're talking about the vulva and whiteness, there can be general whiteness. So like kind of all of this area, kind of the clitoral hood, the labia minora, all of this, down here, the perineum, all of that can turn like a general white, or there could be patches, or they call them plaques, of hyper thickened white skin, or there can be a kind of general pattern of a figure 8. Well, I can't really see down here, right? But you're kind of just tracing an 8, so there can be a pattern of whiteness around there. And importantly, the intensity of the whiteness can really depend on your complexion. So in some folks, it might be something similar to the color of my shirt. And then in other folks, it might be a more ashier white, a more ashy gray kind of white. So that really just depends on your skin type. Another sign of lichen sclerosus will be changes to the vulvar anatomy. So again, I'm gonna take the puppet. So we can have things like fusing, which is where different parts of the vulva will start to stick to each other. So it could be the clitoral head around the glands here, and that would be kind of called clitoral phimosis. So fusing is typically called scarring or adhesions, and when that involves the clitoris, they call that phimosis. Now, if you've never heard these terms before, do not worry, you are not alone. When I first heard these terms, I was like, what the heck does all of this mean? Super technical medical terms that I just like, why else would I know what these terms mean? So I do have a video on this. If you want to learn more about these terms, I highly recommend you do give this video a watch, because knowing and understanding what the medical terms mean, and more specifically what they mean for you and your body, are very, very, very important for your lichen sclerosus journey. So I will leave a description to the video where I describe some medical terms and do a kind of lichen sclerosus terminology video. I will leave that in the description box below, and I will also have a card up here or up here. I always forget. Thank you for your patience. Maybe one day I'll learn. Maybe by 2023, I will finally get this down, but no promises. Okay, other signs can be swelling. You may also have bruising, which the color of the bruise can again just depend on the color of your skin and the intensity of the bruise. And in a lot of cases, the bruising comes from scratching. So you're itching. Let's say you have itching on the labia minora, and you're really, really, really going at it and scratching, and that can cause some bruising. So again, we're talking like reddish, kind of crimson to like a bluish, purpley bruise, something like that. I mentioned swelling. There are also fissures, which are essentially like little teeny cuts and tears of the vulvar skin. So these are all signs of lichen sclerosus, and in all of these instances, these are things that can be visualized, right? So we look at the vulva, we examine the vulva, and we can instantly see the signs. Okay, there's whiteness, and there are some fissures around the clitoral hood and on the labia minora. Okay, there's a hyper thickened, well, you got to use your imagination here. Imagine that there's like a hyper thickened patch of whiteness here. These are all things that you or your healthcare provider can see. Now let's talk about lichen sclerosus symptoms. So a symptom is a feature that indicates that there is a disease or condition, or like some kind of underlying condition going on. Now, symptoms are something that are felt. They are something that are felt by the patient. Importantly now, symptoms are not something that you or your healthcare provider can really see. So let's go through some examples, and then I'll kind of jump into that a little bit deeper. So some symptoms are pain, so kind of general vulvar pain, itch, which can be anything from mild to really severe, and it can also vary in frequency. So some folks don't have itch during the day, but they will report that the itch really comes up at night. And for some folks, it actually wakes them up out of their sleep. The itch is so intense. And others will kind of feel it periodically throughout the day, sometimes at night. So the itch can kind of vary in its quality and its severity, but itch is definitely a common symptom of lichen sclerosus, along with pain. There is also pain during sex, tearing during sex. So you'll feel, as you're having sex, you can, at least in my experience, I could literally feel the skin tearing in some instances. When we're talking about pain, there is also burning pain, and then there is like stinging pain. In the instances of fissures, I describe that pain as feeling like paper cut sensation. It kind of, I don't know, that was always my best way to describe it. It was kind of as if somebody made a bunch of paper cuts on my vulva and then poured rubbing alcohol on it afterwards. So that for me was like a burning, stinging kind of feeling. All right, so those are the main symptoms of lichen sclerosus. Unlike signs though, your doctor cannot physically see your symptoms. Those are just something that is felt by you. So let's use itch as an example. You can be at the gynecologist's office and actually be experiencing a really intense itch moment. And in fact, you are sitting on their table, their gynecologist table, I don't know what you call that. You're sitting there and talking to them, and you just feel the most intense itch. Like all you want to do is scratch, but you're trying to refrain. And you can communicate your symptom. You can say, I am feeling itch right now, but they cannot physically see that itch, nor can you. You can only feel the itch. Itch doesn't really have a physical look. I mean, maybe if you see mosquito bites, but again, you're kind of making an assumption based on previous, notions. And I will get to that. Similarly with pain, you can express, hey, I'm in pain, but the doctor can't really see that. Now, there are some instances where they can kind of make conjectures about your pain. So let's talk about fissures, because that's a good kind of overlappy one. So with fissures, your gynecologist or your dermatologist, your doctor should be able to visually see the fissures, especially if they have, and I don't know the term for this, but you know that like thing that they put on to like really see properly. I want to say like a magnifying glass, but it's not a magnifying glass, but it has magnification power. So they can really go in there and visually see what's going on. Now, if they see that there are fissures on the vulva, they might conjecture, okay, this patient probably feels pain because it's probably painful to have little cuts in you, right? Just like when I see somebody hurt themselves, I don't physically see like their pain per se, but I can know that that person is probably in pain based on previous knowledge. But again, for the most part, symptoms are things that are felt and typically not seen, although there are a couple symptoms like fissures that can be signs and symptoms. Okay, so now I want to talk about, why does this matter? Who really cares at the end of the day? Like, aren't we just splitting hairs over these terms? Does it really matter? Well, I think it does matter, and I'm going to explain why it is actually important to know the difference between these two terms. Knowing the difference between signs and symptoms of LS are very important in two ways. The first way it's important is it helps you better understand the disease itself. And the second way is that it helps you foster better communication with your doctor or healthcare providers. Both of these are super important points. I'm going to go through each one and then give a little example to kind of solidify what I'm getting at. All right, let's start with better understanding the disease. Now, let's say a patient comes in and the doctor says to them, you have no active signs of lichen sclerosus. This can be really frustrating if that patient actually has symptoms. And if the doctor says you don't have any signs of LS, it can feel really frustrating, and it almost can feel indirectly as if they are telling you your symptoms are made up. But they're not necessarily saying that your symptoms are made up. What they are saying is that there are no signs of LS, not that there are no symptoms. There might be symptoms, but what they're saying is they don't see signs. Let's build on this now, because this gets even more important. With lichen sclerosus, not everybody has symptoms. Some people are what we call asymptomatic. Asymptomatic just means that you do not have any symptoms of the disease. You have the disease, but you don't have symptoms. There's a smaller percentage of people that are asymptomatic with LS, but it definitely exists. So in this case, it's kind of interesting, right? I've heard stories where folks go for a kind of routine gynecological checkup. They're just, lying back, letting the doctor do their thing. And the doctor sees signs of lichen sclerosus and then pauses and tells the patient, I think you might have lichen sclerosus. Now, this statement can be really shocking to that person, because if they were not doing regular vulva checks, then they had no idea that there was maybe some whitening or some scarring going on. And since they don't have symptoms, well, they probably thought they were completely healthy down there. They probably thought, like, what are you talking about? Like, I don't have this disease. I'm fine. I don't have itch. I don't have pain. But you can have signs without symptoms appearing yet. So this is another way in which it's super important to know about signs and symptoms and their differentiation. And this builds into the concept of remission. Now, clinical remission with lichen sclerosus means that there are no active signs of disease. This is determined, of course, by your doctor examining the vulva and concluding there are no active signs of disease, therefore you are in remission. Again, this is very, very, very important, because now we have the opposite. Sometimes folks can have no active signs but still have symptoms. Now, if you've never heard of remission in the context of lichen sclerosus, I do have a video where I take a deeper dive into that. I will link that in the description box below. Please feel free to check out that video afterwards. And note that I do have a couple more videos on remission plans, so stay tuned for those. And I explain this more in that video, but essentially it is possible to be in remission and still have symptoms. I explain why in that video, so definitely check it out. But again, this is where those differentiating factors are very important. And this is why it's important to know the distinction between signs and symptoms. Okay, let's talk about communication. So communication has multiple factors, but for simplicity's sake, communication involves listening and speaking. Now, in the context of lichen sclerosus and a doctor, it's kind of a patient-doctor communication where we're taking turns between listening and speaking, listening and speaking. Now, a lot of miscommunication happens in this kind of scenario because of so many factors that are beyond what I can kind of flesh out, but miscommunication is very common. And a lot of what happens with this miscommunication is patients in particular don't understand the terms that doctors are using. So this can be really important and enable you to communicate better insofar as listening and speaking with them. I know that for me, I definitely had an easier time communicating with my doctors once I learned the proper terminology. And, that's not to say that the onus should fall completely on the patient. I think there are two sides of this, of course, and, doctors should be more mindful of the way that they speak to patients and make sure that they understand what that means and not just be like, well, you have some adhesions here and clitoral phimosis and yada, yada, yada. Okay, here's your clobetasol, right? Explain a little bit what that means because most people will not know what phimosis or adhesions are. But again, we can have better communication when we are all using the kind of same vocabulary and we're all understanding what different terms mean. And again, I know this miscommunication happens all the time. It happened with me all the time. And this is in part why I'm creating these videos, these kind of terminology videos, is to help you be able to better communicate with your healthcare provider. Maybe you are calling them up and you're not sure if you have lichen sclerosus, but you say, I think I have signs of lichen sclerosus. For example, I have adhesions, labial adhesions, and I have hyperthick white patches. So if you're communicating this to the admin or the nurse, they're putting that in their notes. And again, the more specific we can be with what's going on in our bodies, the better. I think that this is one of the reasons that it took me so long to get my diagnosis. As many of you who have watched my diagnosis video know, I was going in with a chief complaint for the longest time saying my vagina hurts. My vagina hurts, my vagina hurts, my vagina hurts. So what does the doctor do? Well, of course, they look at what I say hurts. They go to examine the vagina. But it wasn't my vagina that was hurting. It was my vulva that was hurting. And in hindsight, I think that had I used better vocabulary, had I used the proper anatomical term for what was hurting me, maybe I could have got diagnosed earlier. Maybe someone would have at least said, I don't see anything wrong with the vulva, but let me refer you to a vulvar specialist. Who knows? Hindsight, that's okay. But I'm making these videos basically to help folks be able to better communicate with their doctors, be able to better understand the literature out there, and just feel more empowered in their knowledge of the disease. So that is it for this video. Let me know again if you like these kind of shorter informational videos, and I will try to make more of those. I hope you have a wonderful day wherever you are. I am sending you so much love, and I will catch you in the next one.